night before my wife passed away, I caught her falling backwards, and I rushed to try and hold her. I couldn't take her weight because she's almost down by the time I got to her. And I ended up flat on my back with her on top of me. She didn't hurt us all.
Colin came to us after a fall. The GP put the referral over to us to Force Clinic. Our program is Able and Stable that we run here. We see patients that come into the emergency department following a fall. They get patched up by ED and then they get discharged home. So I went out and did a home visit and sort of sat down and discussed with Colin what he wanted to do. So then he started coming into the group and just massive change. Well, the program is magic, I think, because my wife had passed away not long before and I was depressed. And it sort of stopped a lot of that. Still think of it a lot. It wasn't only the exercises, the company of people around me. So just a different man. So it really opened up. Did his exercises religiously every day. There's various exercises. Some are harder to do than others. I was pretty athletic actually when I was young. I probably had that up my sleeve because I knew I could do some things. But when I got a bit disabled, I wasn't as good as I thought I was. I thought, how am I going to keep doing this? But no, I got better as I went. At the end of the program, at the 3 months follow-up, we again go back and do another risk assessment to make sure that we've addressed all of what we said in our management plan. We linked him into stepping on. And I have been doing them at home since I finished the program.
There's a lot of effort put in trying to prevent patients falling in hospital. Then on discharge, we try and keep them safe in the community. We link into community services. We link them into physical activity programs and falls prevention programs, such as stepping on, just to keep them safe, well, physically active, and better able to prevent another fall and coming back into hospital. The CEC Falls Prevention Program has appointed coordinators like myself in each local health district. We coordinate all the activities for falls prevention across the district, including accreditation standards. We've got a whole lot of statewide resources now that we didn't have back in 2006 when we first started. Without that structure and without that collaboration, falls prevention wouldn't have taken the high profile that it has.
I reckon they did benefit me, not only mentally but physically.